In August of 2020, Nigeria was certified polio-free by the World Health Organization. But even against that backdrop, there has been cause for cautious optimism on the part of the country's health authorities and continuous improvement in the structures that yielded such impressive results. Joining us now to have a quick discussion on polio eradication in Nigeria and the ongoing polio immunization is Dr. Tunji Funsho, Chairman of Nigeria's National Polio Plus Committee of ROTARY International. I want to say welcome to Newsday, and thank you for joining us. Now, let's go straight to the very first question. Of course, we want to say congratulations and for the wonderful work your team are doing. But you said this is not the time for celebrations, but rather to be cautious about polio not returning. Expatiate on that for us.
Thank you very much, for having me. Yes, I mean it's time to take time out and celebrate because we have never been able to be without the wild polio virus in Nigeria for this long period of time, and we're talking now 5 years without a case of the wild polio virus. But then, as you have shown earlier on in this program, we need to continue immunizing our children, because as long as there's one case of the wild polio virus anywhere in the world, no child below the age of 5 in particular is safe from the disease, because the virus is only a plane ride away. And as long as we still have it in Pakistan and Afghanistan, no child is safe. We have seen in the past where after 30 years, the virus was reintroduced to places like the Ukraine, like Syria, because of mass movement of people who are not immunized. What people don't realize is that adults can shed the virus, can carry the virus without experiencing the disease, but then children who are unimmunized can then, because of the environment in which they live, can now contract the disease through the fecal-oral route, like we say, contaminated water, and food. So we need to continue immunizing our children to ensure that even if the virus comes back in our environment, they are fully immunized. What we've done in Lagos since Saturday is to ensure that we catch up with those children who have been missed, either because of the COVID-19 pandemic disrupting our regular routine immunization, or because we are not able to do house-to-house immunization because of the dangers of spreading the disease, at its height. Now that, transmission is at a low level, taking all the necessary precautions of COVID protocol, wearing masks, sanitizing, and ensure that as much as possible, everything is done outdoors. We're much safer now to go out and ensure that we catch up with those children who have missed their oral polio vaccine.
Once again, congratulations with all these efforts. They're quite Herculean. But we also want to ask about the Bill Gates Foundation. We heard that there were some contributions for the eradication of polio, and we just wanted to know what some of them were.
Well, I mean, the Gates Foundation has been in the forefront of using technology to assist us in ensuring that areas that are not covered, are covered. Also in areas of surveillance, using technology to be able to, as quickly as possible, identify children who are paralyzed, because paralysis can be due to other diseases apart from polio. The only way to be sure is to collect two samples and get those two samples to reference laboratories, which could be, several miles away. Technology assists us in sending information very quickly. The Gates Foundation has also been a partner with ROTARY International by providing funds. Rotarians, raise, according to an MOU we've had with the Gates Foundation for almost a decade now, we raise about $50 million every year, and the Gates Foundation will match it 2 to 1. In other words, at the minimum, Rotary spends $150 million, including the Gates match, dollars on polio campaigns all across the world. These funds go primarily through WHO and UNICEF. So they have been very instrumental as far as funding is concerned. They also have been very instrumental to the production of a new vaccine, which we're using to ensure that the vaccine-derived polio that has been ravaging parts of the world, including West, Africa, East Africa. And that's part of the reason we've had this outbreak response. We use this new vaccine, which is much more stable, much less likely to mutate, and much less likely, to cause paralysis in children. So he has been a great, supporter. And I'm sure you'll be aware that the Gates Foundation and the Dangote Foundation have been in partnership with at least 7 states to ensure that they improve primary healthcare services and routine immunization.
All right, so talk to us about the spike in cases in the Northwest in regards to vaccine-derived polio and how your organization are trying to combat and fight that.
The vaccine-derived, polio is not as serious from the epidemiological point of view as the wild polio virus because it's usually quite limited. It is a product of one, as I mentioned earlier, inability to immunize children because of the COVID-19 pandemic. And secondly, the fact that we had removed the type 2 virus from the vaccine 5 years ago, 2016, because we wanted to prevent, this occurrence of vaccine-derived. We had eradicated type 2 polio virus with the same methods of just house to house, increasing routine immunization, and ensuring that children have access to clean drinking water. But then, as a result of that, you have a cohort of children who have not been exposed at all to the type 2 polio virus. And so the mutated version, found ready hosts in these children. And we know that the parts of the country that have the lowest routine immunization rates, which are, essentially the northeast and northwest, of the country, where, the virus will find, good hosts. I mean, there are areas in the northeast, northwest, that have immunization coverage rate of about 20% or less. So that is why it is festering more there. But as long as we carry out these outbreak responses, going house to house and ensure that we cover all children below the age of 5 in those particular areas, and we do it in succession of about a month's interval, we'll be able to put a lid on the outbreak of vaccine-derived polio in those environments. It is not limited to the north. We also have about 4-5 states in the south, including Lagos, and that's why we're having an outbreak response in Lagos, and some parts of the south-south, parts of the southeast as well. But we are quite, certain that if we continue the way we are doing, and every partner, the government, WHO, UNICEF, the CDC, and the Gates Foundation, if everybody plays their part, as we are doing, the circulation of the vaccine-derived polio virus will be a thing of the past.
Dr. Tunji Funsho, thank you so much for coming to speak with us on this very important topic.